Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. Our health unit continues to conduct proactive inspections and follow up on calls we receive from the public. Over the past 2 weeks, our tobacco and enforcement officers completed 123 inspections, the majority related to non-compliance with the mask order and not physically distancing in a patio setting. In addition, 4 violation notices were issued to business operators for failure to comply with the masking order. As well, our public health inspectors followed up on 351 complaints and education requests that are related to COVID-19, resulting in 42 on-site inspections during the month of August. I will now report our current case counts. There are 128,948 confirmed cases of COVID-19 in Canada and 42,309 cases in Ontario. Chatham-Kent has 363 cases and Sarnia-Lambton has reported 339 cases. Michigan now has 102,468 cases, with 13,650 cases being in Detroit. Today, we are reporting 2,533 cases of COVID-19 in our community, an increase of 12 new cases from yesterday. 6 are close contacts of confirmed cases, 1 is a resident of a retirement home, and 4 are still being investigated by our nurses. Overall, 26% of our cases are between the ages of 20 and 29 years, and 23% are between the ages of 30 and 39. 65% are male and 35% are female. 2,371 cases are now resolved, and 90 cases are still active and being followed by our health unit. 18 people are in the hospital, with 2 people in ICU. Our community has lost 72 people to COVID. 50 deaths have occurred among residents in long-term care and retirement homes. There is 1 retirement home currently experiencing a COVID-19 outbreak. As well, there is 1 outbreak in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you're feeling confused or losing consciousness. Assessment and testing centers include Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette campus. Testing will also be available at the Sportsplex at St. Clair College on September 3rd and 4th. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. To check your result, please go to wechu.org and click View Your Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us again. COVID-19 has brought many challenges to this world. Everyone was impacted by COVID-19, and some more than the others. Some countries have seen cases in the millions, and a large number of countries have seen cases in the hundreds of thousands. As every country is trying to battle this pandemic, we are also battling this pandemic in our region and in our province. We are finding new tools all the time to battle this pandemic locally. COVID-19 is still a new disease that the world has seen, but with over 25 million cases worldwide and with more than 850,000 deaths worldwide, we have learned enough to contain the disease until we develop a vaccine to protect ourselves from COVID-19. We learned that some of our subgroups has seen a disproportionate spread due to the way they work, live, and socialize. We also learned that unfortunately we cannot change everything, but we still can take certain measures to protect us from contracting COVID-19 and also protect the loved ones around us. More recently, we are seeing cases in the community, and some of the cases visiting commercial establishments or having social gatherings while infectious. This serves as a reminder to all of us that we are moving forward as a community to restart the economy and social activities, but we need to be more vigilant in everything we are doing. Right from a prevention perspective, monitor your symptoms, stay home when you are sick, get tested if you're concerned about COVID. For others who may feel well and are interacting with others, please follow all the precautions. If you're visiting a business establishment, please follow the instructions within the business establishment. For example, sanitize your hands before entering the establishment. Wear a mask whenever possible. Follow the directional arrows. Maintain 2 meters of physical distancing at all times. Minimize touching any surface or any product. If you're having a social gathering, please note that the social bubble continues to be 10 and it's not 50. What it means that you should only interact with only 10 people without maintaining any physical distancing or the need to wear a mask. Any other social gathering should follow the 6 feet physical distancing between all guests and use mask as appropriate. I can understand the socialization needs of many people, but I also want to remind that COVID-19 continues to exist in our community. Local transmission in our region is relatively low and is stable with occasional spikes in number of cases, but it can easily change. We as a community definitely don't want to go back to the same situation where we were in July. I want to request everyone to please do our part and follow all public health measures to keep our economic activity going, keep our community safe, keep our case counts low, protect ourselves, protect our families, and protect our community. Until we develop the vaccine or a cure for COVID-19, public health measure continues to be the most effective way to prevent and limit the spread of COVID-19 around the world. It is absolutely important for everyone to limit the number of people we socialize with. We must always maintain a distance of 2 meters while we are interacting with anyone who do not live in the same house with us. Face coverings such as cloth masks should be used in situations where physical distancing is not possible. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with the Windsor Star.
Good morning, Dr. Ahmed. I know you commented on this last week and you weren't able to give much of an answer then, which I understand, but we are hearing more about a possible party thrown by teenagers in LaSalle recently that has possibly led to many COVID-19 cases. I'm wondering if any other information there is that you could provide on that or anything in general.
Taylor, just like I responded last time, I think it is more important that we all follow the same guidelines. I cannot speak specifically about any individual cases in the community, but we continue to hear concerns and complaints about these social gatherings and also in commercial establishments when people are visiting these establishments when they are symptomatic. And I think overall, and again, it's not about one particular event. It's not about any particular individual. It is about the entire community and the key messages that we still need to follow. So I can't speak specifically to the event that you're describing, but overall, I do feel that maybe people think that when now we're in stage 3 and things are normal, it's not. We are seeing still cases. The cases are circulating in our community, and the only way we can limit the transmission is by following all these measures. And I know people were following all those measures, and now they're thinking that maybe it's time that they can get back to some of the activities that they used to do. And I don't blame them, but I think the key piece still is, how do you do it safely? And I think that's the most important piece that people need to think about and find ways to do it in a safe manner, in a more in a way without putting anyone at risk. So I do feel that it is important that I reiterate the same message. It is critical that people need to know that. Monitor your symptoms and limit your number of people that you interact with.
And I guess if we could just speak hypothetically, should somebody have a party and COVID-19, somebody's positive for COVID-19 and they spread it to other people, what would the health unit do? Because I understand that you wouldn't make it public. You wouldn't put out a news release saying anybody at this party should self-monitor. I assume public health does find out who was at that party and do the proper steps. So could you just walk us through what public health would do in that situation?
So usually we get notified of all the positive cases in our community in the region will be notified to us, and the moment we get that notification, the first thing that we do is we tend to isolate that case, because the case is infectious at that time and is able to pass it on to other people. So the first step is the containment of that individual case. Once that case is contained, then we start to talk about who else this person that came in contact with that may be identified as a high-risk individuals with the potential to convert into a new case. And then from a containment perspective, we reach out to everyone who's identified as a close contact, and then all those close contacts are given the same instructions to self-isolate. Most of the time, or 90% of the time, those close contacts are not exhibiting symptoms at that time, but are on the verge of exhibiting symptoms. So before they exhibit any symptoms or before they start their infectious period, we ask them to self-isolate and then make sure that they are following all those public health precautions. And any of them, if they are symptomatic or if they're developing symptoms, they are asked to go and get tested for COVID-19. So with many of these events, private events, we are able to track down everyone who visited that party most of the time. And if not, if there's any concerns, then there is that potential for a public disclosure without giving maybe respecting confidentiality of individuals, but giving enough information that would help people to take appropriate precaution and do the right thing of either getting tested, self-isolate, or monitor their symptoms. So all those measures we do after all those investigations, and it's every day. Our team is now getting in touch with many contacts, and the number of contacts on an average is also increasing. So that's why I think it is important that we keep the same message. That most of 99% of the time, if you are a close contact of a confirmed case, you will be contacted by our health unit. Sometimes people don't really understand the difference between a close contact versus a contact or a low-risk contact. And low-risk contacts, people, maybe they are thinking that they were in contact with the case, but they were not contacted by public health. It's because based on the investigation, based on the review, based on all the circumstances, there is a strong possibility that this person never come in close contact within 2 feet of the case in that situation. So those are the instances where we may not necessarily identify people, and but the general advice continues to be the same. If you are a low risk contact, you still need to monitor your symptoms. The likelihood or the risk is low, but that doesn't mean that the risk is zero. So I think that's why the key message is, even when you're having all these gatherings, when you're interacting with others, there's a certain level of risk involved. You can minimize your risk. And the best way to minimize your risk is to follow the public health measures.
Thank you, Doctor.
Any questions from Windsor?
Good morning, Dr. Ahmed. I'm seeing that from yesterday to today, the number of hospitalizations increased from 7 to 18. I'm just wondering if we're seeing like a surge, or what actually might be taking place in that situation.
So what I can tell you is, as Teresa mentioned about one of the retirement home that is in an outbreak right now, and based on our conversation and discussion with our health sector partners, we are trying to manage the outbreak in the best possible way, recognizing the limitations physical space limitation of the facility, recognizing some of the challenges with the infection prevention and control measures, and finding best way to support them. So based on that conversation and discussion, some of these individuals have been transferred to the hospital, not because they needed hospital care, but most to ensure that they are monitored and followed appropriately by a healthcare provider in a setting that allows them to self-isolate them in a better way. So those are some of the reasons that we have seen that spike. It's not necessarily new cases, but it's some of those individuals who are infectious, and just because of the some of those limitations at the facility that that are transferred to the hospital for better care and better infection prevention measures.
Okay, thank you.
Any questions from CBC?
Yes. Hi, Dr. Ahmed. I don't know if this would be Dr. Ahmed, but the issues that the orders that were issued with the failure of masking, what exactly does that entail? Does that mean that business staff were not wearing or customers were not? Like, what exactly did those situations look like that caused an order to be issued?
So the notice of violation that I referred to, the four, are for commercial establishments that are not adhering to the masking orders. So it could have been regarding their own policies and practices, and actually staff, or the implementation of the mask order. So initially it's education, and after repeated education, the graduated approach is the next step, is the notice of violation.
Okay, thank you. And then just another question. I'm not sure if this is what Taylor was referring to, but on Saturday, the health unit reported 15 cases that were due to close contact with a confirmed case. Did those cases reported on the weekend involve a number of students from Villanova High School?
I can't speak specifically to that. I'm not particularly aware of any institution at this time. What we reported is our cases that are identified as close contacts, and I cannot speak specifically about any particular institution. Sorry.
And just a follow-up to that, does the health unit plan to warn the public when there are cases from a school community?
Well, definitely. I think as we are moving forward with this school reopening, we are looking at our all the triggers that would that will help us issue an alert from a school setting perspective among the school age group, children attending school and any gathering outside of after school program and all those details. So all those details that we are currently working on to keep the community informed, and we'll keep all this information on our website. It's dedicated for school information.
That's great. Thank you so much.
Any questions from AM 800?
Teresa, with the 4 violations, what are the next steps? Will the health unit continue to monitor those 4 establishments to make sure they're following all safety protocols?
So we will continue to monitor the establishments, and if needed, charges will be the next step.
Disappointed that these 4 establishments are not following the safety measures that have been put in place. I guess once the enforcement officers go out there, what kind of reasonings are they given why these businesses are not following?
I don't know the exact details, but our tobacco and vaping enforcement officers have given the establishments plenty of education and time to comply. And so after continuing to monitor them and seeing repeated offenses, the notice of violations was the next step. And then, as I said, will progress to charges if needed. But as Dr. Ahmed continues to say, we all have to do our part, and that includes commercial establishments where people attend.
Thank you. I have a question for Dr. Ahmed, but I'll ask on the follow-ups.
Okay, any questions from Blackburn?
No, asked and answered. Thank you.
Okay. Any further questions from the Windsor Star?
No, thank you.
Windsorite?
No, thanks.
CBC?
I'm good, thank you.
AMA 100?
Dr. Ahmed, I'm not sure if you saw, but the fitness club in Tecumseh Lakeshore area sent out an email to their members, talking about the process that went down over the weekend, basically calling out the health unit and media outlets. I'm just wondering, can you go through that process again? I guess the timeline, when the health unit gets in touch with the business, when they let the public know. I know you touched on it yesterday, but it just seems like some businesses are putting the blame on the media and the health unit.
Oh, Bob, Bob. Rob, it is disappointing. I think we can understand that the businesses have their own concerns, especially around the COVID time. There's a lot happened with some businesses really felt the heat of COVID. But what happens from our perspective is every time when we become aware of a case, and then what we do is as part of the case investigation, we get into all those details that what happened before this person became infectious, or so two aspects. One is how this person acquired the disease, and then the second aspect is how this person potentially have transmitted the disease. So the disease acquisition piece is obviously something that our team do the investigation and then follow up with the case to identify a potential source, potential contact, that how this disease was acquired. Once that determination is made, what the next step is, we try to identify the infectious period. So if someone started to show symptom today, we go back 48 hours prior to symptom onset and say, okay, so 48 hours, there's a possibility that in the last 48 hours, this person was potentially spreading this to other individuals who are in close contact or close proximity with that person. And during that timeline, if we identify a business establishment, if we identify that this person has attended events or went to some places where there were other public involved, and there's a risk to all of these public. So we tend to identify that timeline, and if it involves any of the public spaces where majority of the public are going and visiting, we tend to disclose that information to the public to help them understand, because practically it would be very difficult for anyone to track down on who was there, how long they were there. And even though when businesses are saying that they're maintaining their list, I'll tell you that those lists are not comprehensive. There are missing information. And even though that they are trying their best, and I don't want to blame them, but what I can say is that list is incomplete in many situations. So in order to protect the interest of the public, it is incumbent that we let this information out to help people who visited those establishments. There are situations, and I can say people don't even want to sign up, like, whether they visited the establishment or not. So there are a number of reasons for that. And again, as I said yesterday, it's not about the business. When these notifications are going out there, it's not about the business. It is about the people who visited those establishments. When our team is connecting with the business, what we are trying to do is we are trying to ensure that all those measures are being followed. So that's a dialogue, that's a conversation between the health unit and the business. And then the businesses are given specific instructions or specific direction that what they need to follow to ensure the safety and well-being. And again, there are some educational opportunities every time that we are interacting with these businesses. We are doing that, but again, the purpose of this notification is not a reflection on any of these businesses, but rather it's a tool to help people get that information out there. You can talk about naming of the business and then people are getting upset about it. I get it. It's understandable. But again, the message is not that any particular business is at risk. Anytime you're outside any commercial establishment, you are putting yourself at risk. So in order to minimize that risk, what do you need to do? You need to follow those public health measures. So the message is, every time someone is going there, it's not about one particular business. it's one particular business maybe that has been identified where a case was there. And again, some of the conversation, what we heard is about the case acquisition. That's not a question that we are trying to answer. That whether this case was acquired or whether there's a transmission happened at any particular business establishment, that's not something that we are reporting. All we are talking about is there was a person who either in some cases, either a staff person or a public, if they were in that commercial establishment while they were infectious, they are putting others, others may have been exposed and they need to get notified. So that's the only purpose of that. And it is unfortunate that people are taking it upon themselves, that it's targeted to their business. It's not. If we need to target a business, the message would be very different, that the business failed to comply with all those public health measures, and this is what it looks like. This is the business that is charged with this type of infraction. That's the kind of information you will hear from us. And so far as we are saying that we report that there are a number of steps that needs to happen. So it's not about any business. People can think whatever they want. We are trying to support our community in the best possible way, and we'll continue to do that.
Since Friday you named 3 establishments. Saturday there was the Halloween store, and then Sunday there was the 2. Just want to clarify here, were these establishments notified prior to the release being sent out?
So the 3 business establishment on Friday that was that we identified, there was a delay in reaching out to them, and our inspectors got in touch with them as soon as we could. And the timing of that was critical because it was Friday, because the exposure already happened some time ago. We wanted to get the word out, and that's the only instance where the business establishments were not aware. But in all the other instances, businesses were aware because we had that time, and we were able to get in touch with whoever we need to get in touch with to get the message out. But again, I can totally get it. I understand that the businesses wanted to know, like if their business is named for whatever reason, they want to know. But again, there is no action attached to them. If there is any action attached to them, we will be having that conversation directly with the business. It wouldn't be through the media. Those interactions, those violation or concerns that we will identify, that will be a direct conversation with the business and nothing to do with the media or the public, which we have done many times as well. When we are reaching out to the media, it's about the public. It has nothing to do with the business establishment or our role with the business establishment.
Sorry, one more quick one here. In regards to those 4 violations, to the point you just mentioned, so if they don't follow the measures moving forward and they get charged, then the names of those businesses would be released?
Under the disclosure piece, yes, they will all be released, and it will be public.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
Thank you, everyone.